Share my screen. All right, my team, can you guys see the PowerPoint? Try to get it up on share though.
We can.
I can't see the button. Okay, there we go. That Zoom bar loves to be in the way. Okay. Thank you for everybody joining us for this virtual with the vet this month. We are talking about panleukopenia, and our special guest is Dr. Funky. The rest of our team is here as well. Myself, Ashley Ray, Jennifer Rosen, and Allie Bradley. I don't think Kellen joined us, so maybe not our whole team, but almost everybody. So I'm going to go ahead and let Dr. Funky tell you a little bit about who she is and what she does at the shelter, and then get started. So go ahead.
Thank you so much for the introduction. I'm Dr. Funky, and I am the Veterinary Programs Director at Michigan Humane. I've worked for Michigan Humane for 12 years now, and I've had pretty much every job that a veterinarian can have there, including the shelter vet at West Sand for about 5 years. And so panleukopenia is probably one of the most important topics that we can talk about in a shelter setting when in regards to cats and especially kittens, which are my other special interest. So I'm really happy that you guys are also interested to learn a little bit more about it today. Next slide, please. Okay, so what we're going to cover today is what panleukopenia is, who's the highest risk for it in the shelter, how it's transmitted, how we can prevent it, a little bit on how we treat it, as well as how you as a volunteer can help participate in keeping animals healthy. And then at the end, we'll have some time for questions and answers. So, and I think while we have this conversation, it's really important to keep in mind that we have a responsibility to shelter animals to keep them as happy and healthy as possible during their stay at Michigan Humane. So we're going to be talking a lot about why we have certain kind of rules in place to try and ensure that we're not spreading panleukopenia around the shelter. Next slide. So first, let's just talk a little bit about what it is. So feline panleukopenia virus is technically in the parvovirus family, so it is related to canine parvovirus. Some of you may be familiar with canine parvovirus, maybe others not. But canine parvovirus actually developed when feline panleukopenia virus mutated and jumped into dogs. So they're not closely related enough anymore that they jump back and forth. But that's kind of where it came from, because before the 1970s, there was no such thing as canine parvovirus. But if you know anything about parvovirus, panleukopenia has some similarities because they are genetically related to the canine parvoviruses. So the first thing is that it's a non-enveloped virus, and that probably doesn't mean a lot to most of you, but the envelope is the outside of some viruses that serves as a protective coating, kind of like a skin for the virus. And some viruses have them and some viruses don't need them. But the reason why that's considered important is because the envelope or the outside is what a lot of the disinfectants are going to target to destroy. Because the inside part of those viruses is not going to be able to survive without that envelope. But if you have a virus that doesn't need an envelope in the first place, then you sort of lose your target for disinfection. And so you're going to find that a lot of the disinfectants don't work as well for panleukopenia as they would for other types of viruses. It also means that it's going to be longer lived in the environment for similar reasons. The envelope for other viruses would degrade over time from UV light and temperature and drying out and all these different things. But if there's no envelope there in the first place, we're going to find that these types of viruses are going to live much longer in the environment than other types of viruses. The second thing that's important to know about panleukopenia is its characteristic feature is that it attacks rapidly dividing cells. So when your cells are splitting apart and growing into two new cells, that's the time that it dives in and makes its moves, right? So rapidly dividing cells are going to be found more commonly in different types of organs. So that would be specifically the GI tract has a really high turnover of cells in it. The immune system, because your body's always making red and white blood cells. Your nervous system when you're a young animal, as well as your heart when you're a young animal. And we get the name panleukopenia because if we break down that word, it says pan means all, leuk means white blood cells, and penia means decrease. So it means all of the white blood cells are decreased. And that's because the virus is targeting the white blood cells. And a characteristic feature of it is we'll see white cells almost non-existent on blood work when we run blood work on these animals. So that's where it got its name from. It's also very highly contagious, as well as having a very high mortality rate. Next slide. So we have a couple populations that are extremely high risk for this, primarily kittens, as well as if we were talking about dogs with parvo, would be puppies. And that's because kittens are going to have more rapidly dividing cells in their bodies than adult animals are. So we typically see a lot of this in kittens. The other main reason that we're going to see it in kittens is older animals are going to develop antibodies to it, either usually, hopefully, through vaccination, or if they've survived an infection when they were a kitten, and that immunity is pretty long lasting. So kittens are the main susceptible group, although unvaccinated cats, they may be more likely to survive, but they still can certainly catch it and be quite sick and sometimes still pass away from it, as well as cats who are already sick from other things. So if you have an immunocompromised cat, they may not be able to produce the antibodies that they need. The vaccines may not work appropriately in those animals, even if they've received them. So sick cats as well. Next slide. All right. So now we're going to talk a little bit about how it's spread. So there's a lot of different ways that viruses in general can be spread. We can think of like respiratory diseases going through sneezes and being airborne and stuff. Luckily, panleukopenia is not airborne. However, it is shed from pretty much any sort of secretion that you can make with your body. So feces, urine, vomit, and it also happens to cause a lot of diarrhea. So they're shedding a lot of that. And a really sick animal is shedding a ton of virus particles. So the quantity of virus particles matter because those are going to get spread around the environment more and have a higher chance of other animals picking it up. When an animal catches panleukopenia, they can shed that virus for up to 6 weeks after they've recovered. So it's got a long shedding period. Now, it's not going to shed as much towards the very end as it would during the very beginning of when they get sick, but it is important to recognize that they may shed for up to 6 weeks. They also, when an animal is exposed to panleukopenia, can have an incubation period of up to 2 weeks. So that's why sometimes we'll see animals that look healthy coming into the shelter, or even animals that we adopt out that we think are healthy, and then they'll get home and a couple of days later they may get sick. And it's because that virus can be hiding in their bodies for a little while. As we talked about previously, the virus can live for long periods in the environment. And so that's where you see those deep cleaning things coming in after we've had like a quarantine or isolation for panleukopenia, trying to make sure that we're wiping it out of the environment, because if you're not cleaning that way, it can hang around for 3 months, 6 months, whatever. And sometimes we have fosters that have to take a whole year off of fostering, just because we can't guarantee that if we put new kittens into that household, they won't also contract the virus. It can be spread by direct contact between kittens. So like think litter mates, that kind of thing. And that's also another reason why we try not to overmix kittens in the shelter. But in the shelter is going to be fomites. So fomites are considered any sort of object that like comes in contact with like fecal matter or virus particles, and then without that animal ever being next to the animal brings the virus to the animal. So that's the big one. And you can be a fomite, right? So your body parts, your hands, scrub tops or t-shirts, if you hold a lot of animals up against your chest, can be foam mites. And they've done studies in the past where they have like a little machine that you can point at things that measure like bacteria and virus counts. And they measure it on like people just walking into the shelter, their hands, right? And there's like not much there. And then on a shelter worker scrub top, it's like hundreds and thousands of millions of bacteria and viruses. So just can't drive that point home enough that the more that you're interacting with animals, every animal that you touch, you're picking up germs and then you're bringing it to the next animal. Litter pans, clothing, baby scales that we like to weigh those kittens on, all those things can be foam mites, right? So it's really important that we're following really strict procedures when we're doing those things. So that's why when we ask you to interact with kittens, that you are changing gloves between each cage of kittens, because those kittens in that cage are already in direct contact with each other, but you don't want to bring it to the next one. And if you need to pick up a kitten and carry it, if you're going to have any sort of contact where it's like close to your body, you either need to have a clean towel in between you as a barrier, right? Or you need to have one of those yellow gowns on, or you need to just keep it to the touching to the gloves. Hand washing can also be effective, but hand washing has to be like the long way that you do it, where you have to wash for, I don't know, it's like 2 to 5 minutes, singing happy birthday, that sort of thing. So it's a lot of the times easier because it's impractical when you're going through a lot of cages of cats to use the gloves, but hand washing in addition to the gloves can also be beneficial. When we're cleaning litter pans and shelter blankets and stuff, we also are following specific directions on those things to make sure that we're disinfecting them to a level that will actually kill panleukopenia virus, because just washing it normally won't necessarily do that. So everything that we do is built around these types of viruses and trying to make sure that we're not spreading them. Next slide. So what are the symptoms of panleukopenia? So actually in kittens, the most common symptom is just sudden death. We don't actually a lot of times even notice that they're sick before they just pass away because it can be that rapid. The ones that do not suddenly die, the next most common thing that we'll see is diarrhea, and oftentimes it's a bloody diarrhea, but not always. It can be accompanied by vomiting, loss of appetite, severe dehydration. That's often why they die so fast, is because they get dehydrated before they even have a chance to have the diarrhea. Depression, weight loss, intestinal hemorrhage, as well as immune suppression. So even if the diarrhea and dehydration isn't what's taking them out, when your GI tract sort of breaks down and has basically a bunch of open sores on the inside, right? That's an opportunity for the bacteria that usually live inside your intestinal tract to go across to the other side and get into your bloodstream and cause sepsis or like a bacterial infection of the blood, which can also kill them really quickly. And they have no immune defenses against that because it's wiped out their white blood cells. And this can be also really frustrating because the most common medical problem that we see in kittens in the shelter is diarrhea. And not all kittens that get panleukopenia are the ones that are sick enough to necessarily die. And a lot of the subclinical ones, it can be hard to pick out which one is panleukopenia and which one is just having sort of run-of-the-mill kitten diarrhea. And so you can sort of have it subclinically running in your shelter for a while, and then it hits ones that maybe have less of an immune system and just takes those ones out, and that's how you know it's there. But that's why even if we don't think a kitten has panleukopenia, we sort of have to treat everybody as suspects, because so many of them have like low-key symptoms. Next slide. Okay, so when we talk about how to protect animals in the shelter, vaccines are going to be one of our most important tools. So the way that we give vaccines is anytime, starting as early as 4 weeks of age is when you can start, but they could come in at any time. So it could be older. but we vaccinate them every 2 weeks, which is the closest interval that you can vaccinate an animal at, until they are over 16 to 20 weeks of age. And so rather than having like a start point, we have an end point, right? And that's because when you're giving vaccines to kittens, they have already received antibodies from their mothers. And the antibodies that they received from their mothers when they were first born and nursing can actually interfere with them developing their own antibodies to the vaccine. So it can prevent the vaccine from working. So and the maternal antibodies protect for a while, but they start to drop off, right? And become less protective. And then you need the vaccine ones to sort of ramp up and become more protective. And there's like this sort of period where the maternal ones aren't working yet and the vaccine ones aren't working yet, usually in the 5 to 12 week range. And that's where we see the most panleukopenia. And that's why we give the vaccine so frequently, because we're trying to hit them as frequently as we can to stimulate that immune system response and get them protected. After they're past 16 to 20 weeks of age, if they've been fully vaccinated, our chances are 100,000 out of 100,001 are protected against panleukopenia completely. So that's the good news, is that the vaccines work really, 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 really well. They just don't work until a certain age. The next thing that we're going to do is make sure that we are always following the personal protective gear. And we call it personal protective gear because it's human terminology, right? It's to protect people also from catching disease, but it's also to protect the animals from you being the fomite, right? So we make sure that we follow all the rules on that. Gloves, gloves, gloves all day long. Change the gloves between and be paranoid. Like honestly, like if you're someone who's helping doing something like weigh kittens or something like that, like any surface that kitten touches on needs to be like a virgin surface that nothing has touched before or have been properly disinfected. So clean towels, clean pee pads, clean bowls, everything has to be never touched by another kitten prior. And make sure that you're using the appropriate clothing barriers for the activity that you're doing. In terms of disinfection, I know we talked a little bit about this, but what we typically are using in the shelter is Rescue. And Rescue is one of the few cleaners that is labeled to kill panleukopenia. But the back of the bottle where they give you instructions on it actually matters, because Rescue can be mixed to different concentrations and not all concentrations are going to be labeled for killing panleukopenia. So it has to be at the highest concentration to be able to actually kill that virus. And then it also has to sit for the correct amount of contact time, because if you're just spraying it on and wiping it off, or if you're spraying it on and there's like litter in the area still, that cleaner is not going to be fully effective. So you first have to remove all organic debris. So that means like cat litter, cat food, cat poop, anything like that, because that's going to suck up the Rescue and prevent it from actually having full contact with the surfaces, right? And after you removed and wiped down and cleaned the organic debris so that you have like a smooth surface, you then have to spray the Rescue and you have to let it sit for, I believe it's like a full 10 minutes for it actually to be effective at disinfecting for panleukopenia. And that's why when you see us deep cleaning something because there was a cage or a room where we had panleukopenia or parvo, and it's such an ordeal to clean it, because we really want to make sure that there's no virus left in that room. So we are like soaping the whole entire room down 3 separate times, preferably cleaned by 3 separate people. So if one person forgot to scrub the bars, maybe the next person's going to remember that area, just to make sure that we've purged that area of any possible virus before we put more animals into there and believe that it's a safe space again. We also want to make sure that if we do find an animal that has panleukopenia, that we're taking appropriate isolation and quarantine procedures. So I thought this would be a good opportunity to talk about what the difference between a quarantine and an isolation is. So isolation is going to be for the sick animal. So if I have panleukopenia, I am going into isolation. And that could be for up to 6 weeks, because remember, if I'm sick with it, I can shed it for up to 6 weeks. But then we have to figure out what we're going to do with all the rest of the animals in the room. And maybe they weren't in direct contact with the animal, but since we've talked about how important fomite transmission is in this disease, if you've been in the same room as that animal and we've gone through a cleaning cycle where the cleaners are going to every single cage, even if they've done their best to try and maintain all the proper protocols and stuff like that, there's a possibility that the virus could have been transmitted to that time. So the quarantine is the period that we are watching an animal to see if they are going to develop the disease. And since we talked about the incubation period being 2 weeks, that's typically around how long our quarantine periods are for that disease. Since the quarantine is considered like a high risk time of another animal potentially breaking with it in that room, that's why you're going to see us go like full hazmat in those situations, and why it's so important to make sure that we're paying attention to those signs that tell you when you can't enter. Staff is going to be going in there with shoe covers that are going to come off before they leave that room. They're going to have gloves on that come off before it touches the outside part of the door handle, and they're going to have a full gown on to protect their clothing. Oftentimes, the people that are cleaning in that room may not clean other cat areas for that day. They may work on dogs for the rest of the day just to kind of cross prevent transmission. So that's kind of what's going on there. Next slide. Okay, so just talking a little bit about how it's diagnosed and some of the struggles that we have as veterinarians. So the first thing that we're looking out for is compatible clinical signs, which, as we mentioned, can be difficult because sometimes, like if it's a year-old cat that's maybe gotten a single vaccine against Panleuk, it might not have full bone, I just died in my cage, or I'm half dead sort of symptoms. It may just look like normal diarrhea, right? Um, but if we have something that sets off our alarm bells that is more than that, a kitten that was looked fine yesterday and is like lethargic and won't stand up in its cage, or one of the kittens in the litter is suddenly found deceased, um, lots of vomiting going along with the diarrhea usually throws off a red flag for me. Then I'm considering those kittens like a panleukopenia suspect, especially if they're in that 5 to 12 week age range, because like my brain just is like, that's the danger time. So we don't have a panleukopenia snap test, but we do have a parvo snap test. The parvo snap test was made for dogs. It's designed to detect the cousin of panleukopenia, and it does sort of work, but not with the same accuracy that it would for dogs. So we don't like 100% trust a negative result. Really looks like panleukopenia, then I'm still pretty suspicious. And in those cases, I might also run a CBC looking for that dropped white cell count, because if I see that, then I'm like, oh yeah, that's it. The hard part is when you have a little kitten, they sometimes don't have a lot of blood to give to be able to run those types of tests. Sometimes we save the CBC as the last thing just because we're not necessarily going to get that option. So it can be frustrating to diagnose as well. There is a rare false positive that we can sometimes get on a SNAP test also if an animal's been recently vaccinated, but those are usually pretty faint positives. So we usually sort of have to make our best judgment off of the constellations of signs that we have. If we say like have a litter where maybe one of the kittens died, that flag does, and the rest of the kittens sort of look okay, but they're like testing positive, we might go ahead and treat those under certain circumstances if we can like appropriately isolate them without putting the rest of the animals at risk. In which case there is no cure for panleukopenia. It is sort of like similar to a flu in humans, right? Where we have to let it run its course. But if you make it through it okay to the other end, you're probably going to be okay. So a lot of times we're just doing supportive care to address the things that it's causing. So dehydration would be like one of the primary ones that we see animals passing away from. So we're trying to maintain them with fluid therapy. Again, kittens are so little that it's really hard to get good IV catheters in them. So it might be sub-Q fluids, which is a little bit suboptimal, but that's what we would do. Immune suppression, we're going to try and address that the best we can with antibiotics since they don't have white cell counts that are going to be protective. And then a lot of them are also losing more fluids from nausea. And if they're not eating, then they're not able to maintain their weight. So we're going to also add in anti-nausea medications to try and help them with that part of it. But regardless, in the younger kittens, unfortunately, still does have a very high mortality rate. Next slide. All right, so you as volunteers can help by making sure that you're following the safety protocols. If you're not sure what you should be doing in a certain situation, always ask the shelter staff. They know how to handle quarantines and things like that. Like the back of their hand, they can talk to you about whatever the procedures are for a specific thing. If you see kittens that are displaying suspicious clinical signs, as we talked about, they sort of all have diarrhea, but like diarrhea and they look like crap. Please report those. And make sure that you ask questions if you have them. In your own homes, just make sure that your cats are up to date on vaccines and make sure that you're keeping unvaccinated cats inside, especially kittens. All right. I could see questions popping up in the chat, but I didn't get to read them fast enough that I could answer them in real time. So I guess I can go back and answer them now.
I got quite a few. Do you want me to read them out or do you?
Yes, please.
Okay. All right, let's take a look here and please go ahead and keep putting them in the chat if you have them now or if one of these questions sparks something else for you. And then if you want to talk more, we're going to have to wait till we come off of like our screen, but we're going to do these questions in the chat first. So our first question is, are you concerned about other viruses jumping to cats and dogs? So maybe outside of this one, are there other ones that we're concerned about?
Like just in general?
I think so. I think that's the question. Like, are there other ones that could be at the shelter that are able to pass between?
I mean, I guess that's always a little bit of a concern in the back of my head, but I can't control that, and there's only so much we can do, right? The incidences of that happening are small, but when a virus crosses over and is able to then spread within that new species, those incidences are bad. That's why we had a big parvo outbreak back in the 1970s when parvo first came into existence, and then it just sort of became its own regular thing, just like panleukopenia. But that was what, 50 years ago at this point. And so that doesn't happen super frequently. It's not like an everyday occurrence, but I mean, they can happen. I think that's what's happening with bird flu in cows right now and cats. So
Yeah, so if we find out more, maybe another virtual in the vet with the vet is down the road if that becomes an issue for us eventually. Is an experimental vaccine being worked on or created at this time that you know of?
well, there already is a vaccine that works for panleukopenia.
Tom, I don't know if you have any more specifics with that particular question.
Yeah,
'Cause I'm not sure.
I was just wondering if they have an experimental vaccine for kittens that do have Panleuk.
Oh, so that like they're working on something like that with parvo right now. They could extrapolate that to Panleuk at some point. I'm not aware if they're doing it currently. But it's different than like a real vaccine, if that makes sense, because vaccines are more of like a preventative thing. I think it's more of like a monoclonal antibody treatment.
Thank you.
Is it okay? Um, is this the same disease also known as FIP?
FIP is not really a virus. FIP is very hard to explain. That would have to be its own lecture. But it's definitely not the same one as panleukopenia at all. Different symptoms, different way that it comes into existence, sort of maybe part virus, but also part of how an individual's body reacts to that virus. So like not at all. Just they all have similar sounding acronyms because they're all feline things, so they all start with F.
Richard, we can see about getting some information for you and send that to you at a later date if you would like more. Let's see. Can exposure to a sick kitten be transmitted to a dog in your home? So, Len, are we talking about any type of sick kitten? Are you concerned about anything being able to be passed to your dog, or are you talking about this specific disease? You can come off mute or type it if you'd like. Maybe.
I'm just gonna answer it, I guess, as like if it were talking specifically about panleukopenia today. So, like I said, kind of in my previous answer to the other question, like viruses can jump between species, but that's not a common occurrence. So think 1 in 10 million. And when it happens, it's notable. Everybody notices because that's how you get things like COVID, right? But they don't happen super frequently. So like it's not something that I would manage for in my home in terms of a risk. However, if I took a panleukopenia kitten home, I would probably keep it as its carrier so that I didn't have to disinfect my entire house and not have kittens for 5 years. And if I had a healthy kitten that broke with panleukopenia in my home, that is also why I keep them to something like a combined bathroom so that maybe I just shut down that bathroom, not my entire life. So yeah, but there are other things that cats and dogs can pass between them. So we still recommend keeping them separated for 2 weeks when you're fostering them. Like ringworm. Nobody likes ringworm.
This isn't quite a question because it got answered actually by another volunteer, but what is the best thing to do if you notice a kitten with diarrhea while volunteering? And we got a response that says alert a staff member, which is absolutely correct. If you are unaware of the place that you can put medical concerns at your shelter location, we can point those out to you if you're not familiar with those. So if you ever come across an animal with anything that is medically concerning to you, even if you think, well, it might not be anything, we want to know about it, and our team will take a look when they go on their rounds. So please ask your coordinator if you don't know where that location is. We will point it out to you. Let's see. Go ahead.
Can I add something to that? I was just gonna say, I threw that in there because definitely report it, but also if you see any symptoms that look like it could potentially be Panleuk, the first step is don't open the cage. Make sure you stop, and that's your stopper right there. Well, I should talk to somebody first before I do anything, and probably don't want to interact with that animal if you're going to be socializing with other animals afterwards, just as a precaution.
Sure. Are there any current cases at Westland or other Michigan Humane sites right now?
I actually don't know that answer because it's been working mostly in the clinic in Westland right now, so I haven't walked through any of the rooms. But I feel like they have a board in Shelter Med that says it's been 3 days since our last positive Panleuk, and they keep it updated, so you can check out
There
the
are
board.
yeah, I can answer that question. There are 2 quarantine rooms right now at Westland. I knew there was a quarantine at Detroit. I'm not sure if it's still going on. Allie, I'm not sure if you're with us still. But if you are,
Row 10 is still quarantined right now. I think it still has a few more days.
thank you. And in Westland, they're in area of the buildings that aren't frequented. Well, I should take that back. They are in the back cat, so it's level 2 unevaluated cats. I believe 2 of the rooms right now, or at least one. again, that they end and sometimes a new quarantine can start. So it's always really important at this time of the year if you're working, especially in the unevaluated rooms, that's typically where quarantines are, is to always make sure you're checking the door to a room before you walk in. Usually quarantine rooms or doors are always shut, but still it can be a habit just to walk into a room and not read the signage on the door, but super, super important. Typically we see more of these outbreaks when we have a very high population and a lot of kittens are in care, and that's now summertime. So
This one, I'm just going to go back. It's not a question, but it's a note that Jen dropped into the chat. And just in case not everybody saw it, it is really important. She's talking about the fact that we have special cleaning instructions for all of our dishes and laundry. We have specific instructions, but also for quarantine dishes. So thank you to all of our volunteers who help in center maintenance or cleaning of any kind. Like, thank you guys for keeping on those instructions and not cutting corners and things, because these are really important. But if you've ever seen at either location like bagged up bowls up underneath the sink or something, those are most likely our quarantine dishes that need to be washed on special settings. So we do have some volunteers who know how to do that properly. It is a little bit of an extra step for those, but thank you to everybody who helps make sure that we get those cleaned properly. And asked about special training. You can ask your coordinator about that. There are sometimes opportunities for that, sometimes not. So go ahead and talk to your coordinator if you are interested in helping in that quarantine dishes or quarantine of any kind, or you come across it and you have questions. We're happy to answer that for you. Let's see. If we have a foster kitten that passes away, are they immediately tested?
Oftentimes, it's sort of like context matters, right? So if we know what they passed away from, or their signs weren't consistent with panleukopenia, then no. Like if I had a kitten that I was fostering that was in respiratory distress, I will probably not test that for panleukopenia because respiratory is usually not a part of it. But most suspicious deaths, yes. We like to post-mortem still at least try and do a parvo snap on them. But it can be challenging because, like we talked about, the parvo snap is not a 100% answer all of the time. And you can't run post-mortem CBC because the blood clots in a way that you can't use it anymore. Sometimes we will also do a necropsy because there are certain signs that we can, which is like an animal version of a human autopsy, where there are certain signs that we can look for on the intestines that are pretty like dead ringer for Panleuk. But it's sort of, if we really are like, oh man, I really think this was Panleuk, and aren't getting good answers from anything else, we might do that.
Next one is, I have a 12-year-old and a 16-year-old cat. Do they need to be vaccinated?
I mean, yes, all cats should be vaccinated. They are lower risk than other cats, but the cat vaccine for panleukopenia is a 3-in-1 vaccine. So panleukopenia is not the only thing that it vaccinates for. So it also protects against herpes virus and calicivirus, which are also common things that we have in the shelter. So, and it only has to be done, I think, every 3 years in an adult cat. So like, you don't have to do it super frequently. But yes, they should still be vaccinated.
And the last one, I think our team can support this question too, but how do you handle or recommend handling the emotions of seeing animals in such difficult situations, especially young kittens? So personally, for the volunteer team specifically, I will say that we are always available to you. If you need to talk through this or you need a moment or anything like that, we obviously will be available to you as long as we can be. We might not be able to leave our desk that moment, but if you're struggling, we will do our best to do that, of course. But I know that we also have like some really close friends that work and volunteer together. If you guys ever need to like coordinate that, we can work with you to just like come in and talk and just have a chat about some things that are struggling, or you're struggling with. We are your coordinators are your resources for sure. We're more than happy to be that support for you if you need it. Anyone else on my team wanted to add to that? I didn't know if you guys wanted to.
I mean, I can answer how I handle it personally for myself. I know it's a little different because I'm a veterinarian, but I mean, it's always sad to see animals struggling, but I understand that like we did not make them that way. They wouldn't be in a better situation anywhere else, and we're trying to help them to the best of our ability. So I get an emotional reward from knowing that I was there trying to do what I could to prevent or minimize their suffering whenever possible.
Yeah, I can add to that too if it's helpful. I mean, there's no doubt about it. This is some of like the most physically and mentally demanding work, and you have to be strong to do it. And that doesn't mean you can't have a big heart. It doesn't mean it's not, I mean, you shouldn't be sad. You should. It's kind of weird sometimes if we're not. But you might see times where it doesn't seem like staff or maybe other long-term volunteers maybe are affected the same way. I think we just get really good sometimes too at compartmentalizing and choosing when we let our emotions show because we need to get through the day. Um, so I also personally, what I will do is I will take breaks away when I'm like, wow, this is hitting me really hard. Maybe I need to take a break away from doing this particular thing. That's where like compassion fatigue can come in when you keep doing more and more and more, but you haven't done enough to refill your bucket yet. So you need to do something that is a little less distressful. And it is hard. Being in a kitten room over and over and over again, especially during these times of years where we might see Panleuk, can be a lot, even for staff. They do go through compassion fatigue and get burnout too. So you're not alone. Um, Again, I actually might have already said this, but anytime you want to talk about it because you're feeling like, wow, this is a lot. I feel really sad. I don't know how to cope with this. We are here. Just sometimes talking about it with another person. Um, really, really helps. And I know this is early to announce this, but we had a really awesome compassion fatigue presentation for staff about a month ago. And that's going to be something we're going to be sharing with volunteers. The calendar is really full right now, but we're planning, I think, in October to launch that. And we'd really love as many people to attend. We're talking about potentially holding that in person and allowing volunteers to come in and watch that recording with us so we can be there to answer questions or just talk through different scenarios that we've experienced. It's a real thing. It is hard to see animal suffering, but like Dr. Funky said, I know that I'm doing the best I can as an individual. I'm working within the resources that we have within the organization. We're never going to save them all, but we're going to do our best to save the ones that we can help. And that's what keeps me coming back every day. You don't do this work for 13 years if you can't figure out how to work through those things and remember that it's bigger than this one animal. We're looking at the whole and how many we can try to help save. So
It's great, Jen. Thank you for that. The last one I just have is phone numbers that we should reach you. We can send you an email. I would say that if we're in person or you can reach us via email, like after you leave or something, that's probably the best way. Phone numbers can be a little bit difficult because we're often moving throughout the shelter or in meetings and things. As much as we'd love to drop everything and answer the phone, especially for a difficult conversation, that can be really hard for us to do. So I've had lots of volunteers just reach out after they go home and then we can set up a time and chat and talk more at length. So that's really do that. Or if we, like I said, can get up and talk to you while we're in person, we would love to if we can. So, but we will have resources and things and contact information in a follow-up email for sure. Okay. Any other questions real quick before we close out for the evening? Can't see you guys, so please put it in the chat. I haven't closed out my screen yet. I can't see your pictures. Okay.
Thanks
All
so
right.
much, guys.
Thank you. Thank you so much. This was great and very informative. There will be a link to this afterward, the recording as well as the presentation. So if you want to go back to anything, I know it's a lot of big jargon. So if you want to go back to anything later, you can and ask us more questions. Okay. Right. Thank you guys. And I hope you all have a great night.